So welcome everybody. This is the first Ask an Expert session in a series that will see topics such as human resources from a legal perspective, mental health, restructuring from a legal perspective, business planning, and marketing. For more details on our upcoming events, please visit edo.simco.ca, and that web address should be shown in the chat for you shortly. The Ask an Expert series has been brought to you today by the Simcoe-Muskoka District Health Unit, the County of Simcoe, the District of Muskoka, the small business centers of Barrie, Simcoe County, Orillia, and South Georgian Bay, the Community Futures Development Corporations of Orillia, Nottawasaga, North Simcoe, and the South Georgian Bay. And I'd also quickly like to thank the town of Collingwood for providing the use of their Zoom technology, as well as Johanna and Hannah, who will be working diligently in the background to filter and screen the chat. Today's experts are Dr. Charles Gardner, who has been in the role of Medical Officer of Health for the Simcoe-Muskoka District Health Unit since 2005. In the past, he has served as the Medical Officer of Health with the Leeds, Grenville, and Lanark District Health Unit, and has worked in general medical practice in Newfoundland, New Brunswick, and Zimbabwe. Dr. Stephen Rebellato is the Vice President for the Simcoe-Muskoka District Health Unit in the Environmental Health Department, where he directs a number of programs. He has been leading efforts associated with the COVID-19 pandemic for the health unit in association with the environmental health and emergency management portfolios. Later on, we're also going to hear from Jenny Elmsley, owner of Free Spirit Tours, who will provide some perspective on her experience reopening as a business. Dr. Gardner and Dr. Rebellato will be providing an overview of how COVID-19 is impacting business and workplace operations, as well as the requirements for reopening and operating safely. Following the presentation, there will, as I mentioned, be a Q&A with Dr. Gardner and Dr. Rebellato, in which we'll be addressing some of the many questions we received in advance of today's session. We'll also, as I mentioned, be keeping an eye on the chat to address new questions that are posted there. With that, I'd now like to hand over to Dr. Gardner and Dr. Rebellato.
Thank you, Tim, and thank you very much, everybody, for joining us today for this opportunity to speak on this topic. I'm going to be covering the first half, which is a high-level conceptual review of the situation, and Dr. Rebellato will be getting into much more detailed matters, followed which we'll be entertaining questions and entertaining some questions that we received in advance. So if you could go on to the next slide, please. So we are going to cover what COVID is all about, the nature of the risks of COVID in the workplace, what needs to be done to make the workplace safer, the province's recovery plan, how that interacts with things, and something of resources that you can use, and then entertain questions. If we could go on, please. So we are in the midst of the pandemic of the century. This is the worst event, I would say, from a public health perspective since the 1918 Spanish flu. Certainly it is considerably more severe than SARS, 1,000 times as many cases. We have over 8 million cases of COVID-19 right now and almost 500,000 deaths. So that's 1,000-fold greater than SARS. You could go on, please. And it's growing, and the rate at which it is growing is increasing. So we have case counts daily that exceed 130,000 cases a day, as opposed to the cumulative number of cases in China at 82,000. So that's really an astonishing growth rate that's continuing to elevate. You can go on, please. So COVID-19 is a coronavirus, a respiratory virus, originally of animal origin in China. It's very new to us. We're still struggling to understand it. Really only began at the end of last year. It's spread via droplet airway exposure. Surgical masks are sufficient to be protective in most instances. We will be talking about homemade cloth masks later on and their limitations. Incubation period, or the period after infection but before you develop symptoms, is about 14 days. And about 20% of cases have been found to be severe. 12% of the cases in Simcoe Muskoka required hospitalization. And we've had just over 7% of our cases result in death. Those who are more vulnerable are older people or those with pre-existing medical conditions. Long-term care facilities are highly vulnerable. We could go on, please. So in Canada, we have almost 100,000 cases and over 8,000 deaths. You can go on, please. And in Ontario, we have over 30,000 cases and 2,500 deaths. At the present time, we have about 190 cases coming in a day. For the past 4 days or so, it's been under 200 cases per day, and that is a milestone achievement. Not that long ago, it was over 400 cases a day coming in. If you can go on to the next slide, please. So this is an epidemiological curve. It shows the number of cases per day over time. And as you can see, we peaked mid-April, and then there was another surge in May, and then finally coming down again. So it's been a prolonged and rough ride in Ontario, and it's had its impacts in a variety of locations, healthcare and long-term care, but then more recently, other workplaces. If you can go on, please. So in Simcoe Muskoka, we have 526 cases or 36 deaths. We've had 15 clusters or outbreaks in Simcoe Muskoka and facilities, most of them in long-term care or retirement homes, group homes, one cluster in a hospital that we didn't declare as an outbreak, and now we have 2 outbreaks on farms. You can go on, please. This is our own epidemiological curve, number of cases per day. And you can see for us, it's been fairly flat. We've managed to flatten the curve, as they say, to avoid an enormous surge overwhelming the healthcare system. And this has really shown in terms of the number of long-term care facility outbreaks, which has been relatively low compared with the municipalities south to us. The demand on our hospitals has been low. The demand in our intensive care units has been low. So all of that has been an achievement by all of us doing everything required with our physical distancing and our general infection control practices in the community, and the closures of work facilities that the government imposed. All of that resulted in this level of activity for us that's been controlled. If we could go on, please. We've managed to avert an estimated 35,000 cases to date in Simcoe Muskoka. If we were looking at the rate of cases that were happening at the very beginning, and if we hadn't flattened the curve and that growth rate had continued, by this point we would have had that number of cases accumulate. So certainly we've avoided the great majority of cases with our actions. We can go on, please. If I could go to, there we go. But we could lose it all again. We have in the community enough transmission happening that if we don't maintain the control measures, the physical distancing, the testing, case and contact management, which is something that we in public health do. We follow up on each and every laboratory confirmed case within 24 hours of getting a report, and then all their contacts in order to put them into isolation so that they don't transmit to other people. If we are to let our guard down on that, and if we are to let our guard down on people doing physical distancing, 2-meter distance from other people, then it could all surge back again and get out of control. So we have to keep that up, including in public spaces such as this image in a park in Collingwood. We can go on, please. So the province has a framework for reopening the economy, and at this point we are well into stage 2, and we're certainly looking at everything that we need to be doing to help businesses as you open in order to maintain a control, a flattening of the curve, avoid or minimize transmission. If we could go on, please. So if you could do one more click, please. We have a much lower rate of transmission than the municipalities to the south of us, if you could click again, as shown by this this map that is color-coded by the number of cases, the transmission rate per 100,000 population. So that puts us in a much better position to be able to proceed with the stage 2. We are among the health units areas that have been allowed to do that with the earliest round. And now we're left with Peel, Toronto, and Windsor, Essex as health units that have remained in stage 1. So if you could click 2 more times, please. So this allows us actually all over the province to open up places of worship with some restrictions. And for those that are in stage 2, including ourselves, opening up a variety of other businesses, including patios for dining. If we could go on, please. If we could click 1 more time. So we've had a lot of outbreaks and a lot of cases in workers in congregate settings such as hospitals and long-term care facilities and retirement homes and group homes, as seen by these numbers provincially. If you could click again. Now we're seeing it in other work environments. So that's really the warning for us all today, that we need to work to minimize that. If we could go on again, please. So there's danger in the work environment. We've had our healthcare outbreaks, and 1/5 of our cases have actually been healthcare workers, and the majority of those contracted their infection from their work environment as part of an outbreak. We've got 2 farm-based outbreaks, and that potentially is a very dangerous situation, because we know that there are many other farm-based outbreaks elsewhere in the province, such as Windsor, Essex, where they have some 17 outbreaks and over 260 cases. So for us, we have 2. It's the beginning. I very much hope it's both the beginning and the end, but we need to work very hard to prevent further transmission in those environments. They seem to be very vulnerable to transmission among farm workers in those settings. But we know that to the south of us in other health units, they've had a large number of outbreaks in other work settings, manufacturing and warehouses and food processing plants. So we have our new venues opening up, whether personal services, or patios, childcare, faith services. We need to work very well to avoid transmission in those settings, let alone what may come with stage 3 whenever that comes. If we could go on next, please. So there's some key overall approaches, but they all come down to infection control practices. So if you can have people not in the work environment in the first place, if they can work remotely from home, then that avoids them being exposed to any potential transmission in the workplace, but it also means that they're not there to transmit. They aren't bringing it in the first place. Hand washing has been shown to be the single most important infection control practice that we know of, and we need supports in place for people to be able to do that. Physical distancing has been shown to be very effective and necessary, but in order to do that, you need supports for your staff and your patrons, your clients. You need signage, you need reminders, you need setup of flow for people in and out of your premises, separate entrance and exit if possible, and demarcation of one-way flow through aisles, and demarcation to help people space as they're waiting in line. There's also the use of barriers such as plexiglass to help protect your staff in those settings as well. And then when you can't do that kind of distancing or can't be assured of it, the use of personal protective equipment and specifically the most common being masks is a key addition to this. And we're becoming more and more convinced of the need for mask use by both the patrons and also by staff. If you could go on next, please. Screening is important, so it's really important that people identify if they have any symptoms and to report that to yourselves as operators. For yourselves to have some kind of screening process in place. Anybody with symptoms needs to be isolated at home and followed up for testing and assessment. And from there, if they turn out to be positive, we are notified of it and we follow up with them and with their contacts. And they do require to be in isolation for 14 days if they're cases. The patrons need to be self-screening, so signage would certainly be helpful for that. Patrons using masks is a good idea for close settings as well. And then I would suggest that you need to be ready for the potential for an outbreak. Know something of what you would do if you have an outbreak on your premises. How would you manage it with us? And what would be your, I guess, your backup for yourselves as a business? If you can go on to the next slide, please. Cohorting is an idea for large employers. If you have a large number of employees, one of the ways you can reduce transmission is to break them up into groups or bubbles or cohorts of people who work together and don't otherwise associate well at the work environment out of that grouping. And that way, if you do get introduction of COVID-19 into your work environment, it can be contained into one of those cohorts and not affect your entire operation. I know that this would take certainly policy and organization on your parts to achieve, but it would be an important thing for you to consider doing. And another thing would be documenting individuals who come and receive your services to enable follow-up as well for exposures. If you could go on to the next slide, please. And it's important to have policies in place to achieve all of those things. Here we've got actually some pictures taken from the farm setting and noting actually two farm workers who died in Windsor, Essex, both young men associated with outbreaks. So it's important to have policies in place to support all of these measures, including the masking and including training people about how to use masks. Okay, on to the next. Dr. Rebellato.
Thank you very much, Dr. Gardner. I think you positioned my slides extremely well. First off, I'd like to echo Dr. Gardner's sentiments and thanking participants. I see we have well over 230 participants today, along with our media outlets and our workplaces. I think your commitment is obvious in terms of your attendance today, and we have a great partnership with our communities and through that with our workplaces for those that we inspect and we don't. And in keeping with that, one of the things that we were committed to at the beginning of the pandemic was the development of resources that were easy to access, that were accessible to a large group of individuals specific to their industry. Of course, we recognize that there are numerous types of workplaces, settings, and setups that make a number of questions that have come through the Eventbrite invitation complex, but at the same time, we wanted to draw people to our website. And this is a snapshot of our website, of our front page, which has a click in terms of going into the COVID pages that speak to the different aspects of what it is that we are trying to communicate to workplaces, to businesses, and the general public as well, who would end up coming into your business and workplace. So when you click into the COVID page, for the purposes of this webinar, if you have another screen to be able to look into it, obviously, I'd like to draw your attention to the reopening and operating of your business tab, which was directly created for the purposes of assisting businesses as we move through the different stages of our operation, your operations, excuse me, and the provincial stages as well, because I'm sure as workplaces and as businesses, you can relate, just like we have, of the difficulties associated with opening your business with, in some cases, general communications. And therefore, what we thought was we would direct a page that is specific to many sectors. So, of course, have the provincial documents, which I'll refer to in a few minutes. But the information contained within this page is specific to various issues that affect not only the public, but yourselves as workplaces and business owners, specific to things like masks, cohorting of staff, as Dr. Gardner had alluded to, PPE, provincial links to key documents that hopefully many of you are familiar with, and of course, sector-specific tabs that I'll show within the next screen, because we recognize in some cases the provincial documents, I think, have done a really good job of providing general information, but of course, within that general information, there is a significant amount of questions that we've done our best to put onto the page in various guidance documents and letters through the medical officer of health that would help from a communications lens and in order to assist your workplace in integrating within the various stages of the reopening. So let's speak about the provincial documents for a second. What you see here is a screenshot from the provincial website that provides specifics in terms of reopening and what stages we're into. We have moved from language of essential businesses to really stages of opening. So we were in stage 1 up until last Friday, or I should say Thursday of last week. And of course, everyone is most familiar with the fact that we are in Simcoe Muskoka within stage 2 at this point. So within stage 2, the government has amended various guidance and sector specific documents, and most importantly, some of the regulations that are associated with each stage that pertains specifically to the operation of your business. So when we look at the provincial page and focus in on some of the pieces that they've been trying to highlight, what they've effectively done is looked at sectors. And I'm going to make an assumption that many of you that have since reopened your businesses and workplaces are very familiar with this page. If you're not, it is a good resource for workplaces to become familiar with, because again, as you see on the screenshot, it provides you with a number of different resources that would assist you along the way in your reopening. So let's speak about some of those resources that are specific to this. I'd mentioned sector specific guidance documents. What you're seeing is different sectors as the phases and stages of the reopening progress. The government added more, and in addition to that, and you'll likely see more of this moving into stage 3 of the second phase of the provincial reopening, as more types of workplaces and businesses open up, one can expect to see further guidance documents to prepare workplaces for themselves in order to get ready for the reopening within the next stage. So there was a couple of questions that came through within the invitation that were specific to restaurants as an example. When or what can I do at this point to prepare myself for my restaurant for in-service dining within the actual restaurant? Well, I anticipate that those types of sector-specific documents will be available to you. And where there isn't, of course, our health unit will assist where we can through a general health connection line or through our webpage in order to fill those gaps where questions are being asked for specific sectors. So again, sector-specific guidance is drilled down to more specific types of topics and workplaces as well. As you can see on this page, of course, very close to heart in terms of Simcoe Muskoka, we had a lot of marinas that were opening up in the first stage. And of course, these types of guidance documents and topic and sector-specific guidance documents were very helpful for us, but not only to us, but also our workplaces and businesses as well, because what they did was provide workplace safety and prevention services, which is an arm's length of the government, to provide these types of documents that were specifically focused on employee health. But in the employee health, of course, that has a way of being able to extend into the public and those members of the public that would come into your business to assist you along the way. So let's talk about the workplace safety plan. And of course, I think everyone is well aware now that this PowerPoint presentation was developed up to the minute, actually. It was as of late yesterday that we received, or the day prior, excuse me, the workplace safety plan documentation that was provided through the province. So this was, again, one of those gaps that we were hearing from our workplaces and businesses within Simcoe Muskoka and across the province, of course, about providing some type of template, a means for workplaces to be able to account for their operations and also account more importantly for the risks associated with their workplaces in order to mitigate for those risks. So looking at protection of workers, customers, clients, screening that Dr. Gardner has alluded to, those types of engineering controls that likely as a member of the public, you would have seen such as plexiglass, those types of things that avoid that close contact that we're looking to avoid. Addressing a potential or suspect case, which I'll address in a few minutes. And this is actually the URL that's associated with the safety plan. And on the next slide, you'll see the page that guides that. And again, this was just developed and shared with us within the past 24 to 48 hours. And once you click onto the download the Word template that you see there in blue, what it does provide is a blank template that's associated with the development of a safety plan. Of course, myself and the health unit would encourage businesses to use this document either to supplement your existing plans that are in place, or if you didn't have a plan, this would certainly fit very well generically in terms of you working within your workplace and your place of business to look at the various components of this plan that pertain specifically to your workplace and how it is that you could mitigate the various numbers of risks that Dr. Gardner has alluded to that this virus invites in, not only from an employee perspective, but from the member of the public as well. So the question has come up a number of times through the questions that came to us through the invitation. In addition to that, through our Health Connection line about what to do, and Dr. Gardner had alluded to this, when you as an employer or as an employee presents themselves as being positive. You have a positive case, whether it be within yourself, an employee or member of the public who were to walk in and has some type of close contact. So what do we do and who's responsible? And these are some of the questions that we received. So I'll go through some of this in high level detail. Dr. Gardner had alluded to the public health unit's role within receiving and investigating reports in cases and contacts of COVID-19. For those individuals that reside within Simcoe, Muskoka, we would receive those cases of COVID-19. And as a result of that, we would investigate where those individuals resided, where they worked, who they were in close contact with, in order for us to put some pieces together as it relates to what Dr. Gardner has referred to in a couple of workplace outbreaks that we have been involved with of late. We will determine if an outbreak actually exists, and of course that takes place with an in-depth interview with those cases and contacts of that individual in order to provide guidance and recommendations to workplaces. Where it's necessary, the medical officer of health through a public health inspector could provide orders under the Health Protection and Promotion Act and make recommendations. And really that is where we've come in these outbreaks that Dr. Gardner has referenced, along with other outbreaks in other institutional types of settings in terms of providing direction and recommendations to these facilities in order to mitigate the risk of ongoing transmission. And a part of that risk in ongoing transmission, because one is not familiar with all the different places a member of the public or employee would go, we may have to issue broader communications outside of our health unit in order to stop that transmission where it is deemed to have started. So further responsibilities of the health unit include referring and communicating with relevant stakeholders. The Ministry of Labor, Training and Skills Development, I think everyone's just more so familiar with themselves as MOL, or the Ministry of Labor. In some cases, they may need to be notified, in particular when it involves an employee. We may need to share our recommendations in consultation and with our relationship with the Ministry of Labor in regards to our ongoing investigation in that workplace. And of course, conducting on-site investigations with various agencies, depending on where the outbreak takes place, is a part of our responsibility as well as a health unit. Let's talk about the Ministry of Labor. Received several questions in regards to their role. They would receive notice of an occupational illness from employers. So that I'll get to the workplace and businesses role in a moment. They would investigate those occupational illnesses and notifications to determine if the employer is in compliance with the General Occupational Health and Safety Act. Of course, that takes place in concert with the health unit, where there's a role to play from a public health perspective. They can issue orders, and I've noted there that there's a contact center for anyone to report health and safety concerns in relation to a workplace, and the employer can use that as well to ask general questions. So let's go on to the role of the employer. They have the general duty under the Occupational Health and Safety Act to take precautions which are reasonable in the circumstance. And of course, that use of the terminology reasonable is of course quite difficult in order for an employer to discern based on the risk, which is why I take you back to the ministry or the province's plan in order to assist you in identifying those risks in order to mitigate them. Implement prevention measures found in guidance, which is, again, goes back to the sector-specific guidance document. Provide notices of occupational health and illness to the Ministry of Labor. Comply with any recommendations or directions or orders that are issued by ourselves as a health unit. And I think Dr. Gardner had made reference to this in recommending of records and the importance of maintaining records of those who worked when, in order to identify in the event of a positive case, who we as a health unit may need to contact, who is in contact with the positive individuals. And of course, a part of that is knowing where your employees are working. So let's go on to some commonly asked questions. I'll take a couple of the slides, and Dr. Gardner will take the following slides. There's 4 in total. What we tried to do the best that we could is compile as many of the questions. You'll have to appreciate that there were several, and we will look to answering all of those questions in the future. First question is, do I have to contact the health department prior to reopening my business or workplace? The answer is no. There is a caveat. Public pools, spas, and public beaches are really the only venues that require approval from the medical officer of health in order to reopen if they were closed in association with COVID. Use of the province's sector-specific guidance documents will assist with those best practices. And of course, businesses such as food establishments that have never opened or pools that have never opened would of course require the approval of the medical officer of health in association with the Health Protection and Promotion Act. Can a public health inspector come to my business to ensure that we are safe to reopen? I would love to. The unfortunate part is resources are quite scarce, as I'm sure people can appreciate for those participants on the line today. Our resources are stretched in terms of dealing with the pandemic and dealing with our mandate, which is under the Ontario Public Health Standards. So with those stretched resources, our focus has been on those priority operations that we are responsible for under the Ontario Public Health Standards. And unfortunately, those that we're not responsible for, we wouldn't be able to visit all of those various workplaces outside of those that we are responsible for. Who can I contact about general public health questions about COVID-19? I trust everyone can see our health unit's health connection line, which is listed there. Who can I contact about public health questions about COVID-19 in my workplace that are normally inspected by a public health inspector? So let's use a restaurant, personal service setting, a pool, a spa. You can contact our general health connection line, and at that point, press the button that's associated with speaking to a public health inspector. I'm unsure if I can open my business at this time. That was a very common question that came into our health connection line in stage 1, not so much in stage 2. You can contact us, or you can contact the Stop the Spread business information line, which is there, and that's run through the province. Who do I contact with questions about employee health and safety? Again, the Stop the Spread business line, and then I've also listed the Ministry of Labor's contact information there as well. And where can I access PPE? This URL is in association with the province, and they have listed an inventory of those companies and businesses that can procure PPE for various businesses out there. There's a line listing of them. And from there, you would be able to contact various businesses in order to access that PPE. Dr. Gardner.
So how can I get my employees tested? Well, of course, there are the local assessment centers there at Simcoe Muskoka, but I would suggest that would be a question of do they need it? When is it indicated? Certainly any employee that is screened positive with any symptoms definitely needs to be tested. If they're a contact of a case, then they need to be advised by us. We certainly will be approaching them after having contacted the case. They can certainly contact us as well. It's always safer to have them self-isolate in the interim until we can get to the bottom of whether or not a test is needed. And right now the province is actually making testing readily available for pretty well anybody who wants it. Anybody who's concerned can get a test. The key thing is those who have symptoms definitely need to be tested. I have employees that have recently went for testing. Should they be coming to work while they wait on the test results? Well, that would depend on the situation. If they're symptomatic, then they should be self-isolating until you get the results. If the results come back and they're negative, then they should remain home until they're no longer symptomatic. If they don't have any symptoms, if they are a contact of a case, they too should be in self-isolation, following up with us to get further direction. If they aren't a contact of a case and they're otherwise choosing to be tested, then there is no need to exclude them from work. They can return to work. Of course, all of us should be monitoring ourselves for symptoms regardless. Should employees wear masks? Certainly, we're advising employees and members of the public to be wearing non-medical masks, cloth masks, in situations where they cannot physically distance. They can't keep a 2-meter setback from other people. And that's going to be a lot of work environments. I think there's going to be many instances of work environments where people really should be wearing a mask, where we strongly advise they wear a mask. Retail environments are a key environment. We also say public transit is an important environment for people to be wearing masks as well. So it's at this point not a legal requirement that they do so, but strongly advised. As an employer, you can make it a policy requirement if you so wish to further protect your employees. There's a higher degree of, controversy about policy requiring your patrons to wear masks. But I think personally that's a reasonable thing as well if you're choosing to do that. I've been asked about that in the media, and I've stated that I feel that's a reasonable thing to be doing. So should I allow employees to carpool? So in my mind, normally we were very big on this from an environmental protection point of view, climate change perspective point of view. Now I would consider that to be a confined, close environment in which there's the potential for transmission. Remember that people can be without symptoms and still potentially infected and infectious. So symptoms alone isn't the thing that you need to be concerned about. If people don't have symptoms, there's still the potential if they're within 2 meters of each other. So I would be suggesting that they avoid carpooling at this time, and if they must, that they wear a mask. We also talk about maintaining distance within the vehicle, if that's a possibility as well, and disinfection of surfaces. What's the ideal requirement to follow for retail spaces for people per square foot? So I think at this point, I'm going to hand this one back to Dr. Rebellato.
Thanks, Dr. Gardner. So there's been a number of questions about this. This is quite a difficult question to answer, although it seems very intuitive. It is difficult from the perspective of what does the space look like. This is a statement from the province, which looks to 1 customer per 4 square meters, 43 square feet, to ensure that physical distancing of 2 meters takes place at all times. Now, taking that into consideration, one has to consider the space. So if it's a retail space and there is, retail goods in the middle, then that may not be enough. So I think what one has to do is look at their workplace, make that determination based on how their retail space is constructed, what types of retail space, retail goods they have available in order to maximize the amount of space. And of course, there are a number of best practices in association with what the province and what the health unit has provided in terms of floor markers, one directional aisles, spacing, signage, all of those things that Dr. Gardner was talking about in order to inform not only the employee, but the members of the public as well, will assist you in terms of making a better prediction in terms of how much space is required, and more specifically, how many individuals one would permit within that space at any given time. I think all of us are quite familiar with places like grocery stores, where we're seeing how that's changed over a period of time based on the requirements and the lived experience of those stores in terms of how much is too much. Dr. Gardner?
That's good. So final thoughts. This is the pandemic of the century. We've worked hard to flatten the curve, all of us together. Now as businesses open, it's your opportunity to help us keep the curve flat and not have a resurge that would be bad for all of us. We're going to be at this for a long time now. We anticipate that this will continue until we get a vaccine, which could be late next year. Therefore, we need to work closely with you to keep the curve flattened. Happy to take questions at this point.
Thank you both, Dr. Gardner and Dr. Rebellato. At this juncture, what we're going to do is welcome Jenny Elmsley, who is the owner of a local business, Free Spirit Tours, just to provide a little bit of perspective in regards to her experience having gone through the reopening process. So Jenny, a few minutes to you if you would.
Sure. Yeah, so we run an outdoor adventure tour company, and we had to really pivot our business, as they like to say. And so what we've done is we now take all of our bookings online. So in the past, we do canoeing and kayaking and stand-up paddleboarding. People would just walk in, we would rent boats. But now everything is booked online, so we know exactly how many people we're gonna get per day. We can monitor the amount of people that we get per half hour. So we do 6 people per every half hour. And then what we do is we actually have to sanitize everything, from the kayaks to the paddles to absolutely everything that they use. And we only use 1 boat per day. We will never reuse that equipment again that day to make sure that everything is completely sanitized. And in the past, we used to drive people to the river. So now we are no longer driving people. We just couldn't see how we could physical distance with our vans. So we have people meet us at the river. So we've had to change our business significantly, but our experience is that customers are understanding. They get it. They realize that there's a pandemic going on and they're willing to comply. So yeah, that's our experience.
Jenny, thank you very much for sharing that. You're certainly not the only business that's reopened. There are many in our communities, and they're probably sharing similar experiences in terms of having to set up new policies, procedures, protocols, and balancing the knowledge of all of that new information and how they can best operate to service the needs of the customer. We've had a few further questions. So to Dr. Gardner and Dr. Rebellato, I'll ask you these. Should businesses be keeping track of customers for contact tracing purposes?
So in keeping with what both myself and Dr. Rebellato had noted, it's important for people to be keeping lists of people and interactions, so clients as well, because you may very well find that you're in a situation where there's been a case that's been identified by public health as having visited your premises, and then it's very, very helpful to you and to us if we can be very specific as to who's been in contact and who hasn't. We will go to great lengths not to, if your business is involved in a case, issue the name of your premises. Far rather just get the closed list of individuals involved so that we can contact them directly and avoid that kind of thing.
Thank you.
And I don't know if Dr. Rebellato had anything further that you would want to add?
No, not at this time. I think that we've provided some guidance documentation specific to restaurants as an example of recommendations to also do the same with clients that are coming in. Same thing goes with personal service settings in order to also track who is coming within your business that may help in the event of a positive case, but nothing further to add. Thank you.
This may be a question you can tackle. We'll see. What can businesses do if customers refuse to follow protocols that you've set in place?
Well, I guess that would come down to your own approach as a business and how you decide to enforce your own policies with clients. I think that's a pretty tough situation to deal with, of course. It's inherently potentially very confrontational. And so I would sympathize. I don't have a magic solution for you. I don't know, Dr. Rebellato, if you would.
Yeah, I think it is a difficult question. I think with our community partners, with municipal bylaw, with our local police detachments, we've established a good relationship. I think that those types of enforcement agencies are there to assist you in those types of unfortunate incidents that may occur. But I do think it speaks to communication in general. I think our website has tried to do its best in terms of linking and providing posters and documentation so that way people can actually see it before they come into the store about what it is that the expectation is, whether it be masking or whether it be hand washing, hand hygiene, things like that, floor markers on the floor, those types of activities, I think, assist with reducing the potential for people and managing their expectations prior to coming into that retail setting, as an example of what it is that you as an employer are expecting of your customers coming in.
Yeah, good advice. Clear expectation setting is certainly good advice. The next question we have here is there a sense, and this is probably the $64 million question, and it's evolving daily, but is there a sense as to how long protocols like this will need to be in place?
So I am involved with an advisory group at the province. I get a sense about that kind of thing. In my opinion, some of this will be needed until we truly bring this to an end, until we achieve what we call herd immunity, which is getting the level of immunity, the percent of the population that's immune to COVID-19 up above a 0.60% or more, where the virus can readily transmit through the population. And that's done with a vaccine, and that we feel will be sometime next year. So between now and then, we're going to have to do as a minimum the physical distancing, the masking if you're in close contact with people, the hand washing, the self-monitoring and the self-isolation, and all the things that the businesses will need to do while operating to facilitate that for your clients and for your employees.
Yeah. In our communities, we often see masks being worn, but we also see face shields being worn. Is there a distinction between the two? Is it better if we're wearing both? Is it better if we're wearing just one?
It's possibly better to wear both. It's done in healthcare. It's part of personal protective equipment in a high-risk situation, providing care directly for a known COVID case that they're wearing in that instance. The full PPE requirements, and that includes a face shield. And in case people don't know what we're talking about a clear plastic shield that goes across the front of the face that protects the eyes. And the point of the face shield in that instance is to keep the droplets out of the eyes so that you don't get infection via that mucous membrane. So right now, there's what's coming to vogue is the idea that instead of wearing a cloth mask, which can be uncomfortable and muffle speech, some people would prefer just to wear a plastic shield. because you can see the person's face. It's better for social interaction. It may be more comfortable, but we don't actually know how protective it is. And it may be that the mask does a better job of screening out droplets from being inhaled as opposed to the screen. In my mind, I'm still recommending the mask. If you want to add a screen to it, then sure, that would be added protection. There's still advisory at this point, not required.
Thank you. Yeah, and there had been other questions about requirements versus recommendations. So thank you for that. Somewhat related to retail, but probably a bit more general. Are there any statistics on the transfer of the virus in retail or perhaps other settings from contagions on product or through food service venues?
So we know that the virus can remain alive for up to 72 hours on surfaces. So that means that we need to be good about sanitation. A lot of the recommendations for work environments is about disinfection of commonly touched surfaces. In theory, there could be the same with food. In practice, we've not actually seen direct evidence that people have contracted this via food, but if it is viable on surfaces, then at least in theory, it's possible.
Yeah. And similarly, we had a question about specific rules for dressing rooms in clothing stores, for example. Is the recommendation to have staff clean them after each use? Contagions that are lasting in there on hard surfaces for the 72 hours would suggest as such.
Yeah, I think that would be a good idea, but I'm just turning to Dr. Rebellato if you have any specifics on that.
Yeah, there's a part in under the emergency orders, and I can actually read it out to the group about fitting rooms. Fitting rooms in a business may open if they comply with the following conditions. So fitting room stalls must be equipped with a solid door that may be closed. Patrons must be permitted to occupy adjacent fitting room stores. Patrons must not be permitted to occupy adjacent fitting room stalls at any time. And fitting room stalls must be cleaned and disinfected after each use. So that is coming right out of the regulation and is specific to fitting rooms at this time.
Excellent, thank you. Proper protocols for managing publicly accessed restrooms. And I suspect this goes for as the public starts to move around more with the weather beautifying for us. And you know, the knock on the door, can I use your restroom? How do business owners respond to that, as well as publicly accessible restrooms?
I'm not sure if it would be different for those that are just coming in seeking to use a washroom versus the patrons, but once again, that would come down to specific regulations. So Dr. Rebellato.
I will answer the question by providing a link in the chat box directly to our public washrooms guidance document. So this was a document that was requested of our municipalities. It was directly developed for municipalities for public restrooms in some type of public settings, but the concepts associated with it in terms of frequent cleaning, access. Recall, with respect to public washrooms, the benefit is, of course, obvious, but the other benefit in terms of what we're dealing with the pandemic is it allows the public to be able to wash their hands. So it's incumbent upon the business, if they are going to continue to permit public washrooms to be accessible, that they have the responsibility to ensure soap, paper towels, and or their hand dryer is accessible, and it's working in order for that to happen. Obviously, that has significant benefits, as Dr. had alluded to, in terms of the importance of hand washing throughout a pandemic in order to control for COVID-19.
This is sort of blend of questions here. In terms of if a location has been identified as part of a traced response to a positive case of COVID-19, what's the impact for that business? Will they have to close? Will public health be supportive? Will they provide solutions, support, etc. in that regard?
So we will always seek to be supportive, and closing is an absolute last resort. We haven't had to do that kind of thing in this situation. We will be turning to yourselves in our investigation in order to identify specifics about, let's say you had a a staff member who's a case, we would be seeking specific information about while they were infectious, and we would know that from the patient's history, the client's history, date of onset of symptoms. We'd know when they're infectious. So we'd go back, when were they at the work premises, and who they worked with and how closely they worked with them, and whether or not masks were used or not, whether or not they were exercising the physical distancing. And then we'd be wanting to identify a list of specific people who would be considered to be relevant contacts for them to then be followed up, put in isolation, history taking, possibility of testing. So we'd be seeking your cooperation, your support, the information that you would have about shifts and people for us to contact and follow up. And we'd be seeking to do it in a way that would be low profile so the public would not know of it. We would not be giving that information to the media unless in a very rare instance where we felt it was necessary because there was uncontrolled exposure of relevance to the public, and that's the only way to advise them and get them to seek assessment. Only in those circumstances would we advise the public, and we haven't had to do it yet. And really, it's a very rare instance in which we would have to do something like that. So we'd be seeking to work cooperatively with you to solve the problem.
That's a great answer. Thank you. Very recently, patios have been allowed to reopen, and questions have been coming in regarding the number of people that could sit at one table, even though there is spacing between the tables. Is there a limitation to that?
Dr. Rebellato.
Yeah, it's a great question. I think that there's a number of different things to consider. So let's talk about the specific patio. Does it have the room to be able to accommodate it? I think we've seen some really unique ideas in terms of how patios and restaurants are arranging their patios. The first tenant and the tenant that we've been recommending and communicating with our restaurants is really remember physical distancing. That is our key tenant moving forward. So depending on the patio, you may have the ability for people to be able to congregate that are within a family, or as the province alluded to late last week, the social bubble that's associated with that. And that may be permissible within a certain setting, or it may not be, because the last thing we would want to do is to encourage patios to get tables closer together, where those that aren't a part of that social bubble, that aren't part of an immediate family grouping, be closer together to those that are not. So we're really stressing to our restaurateurs, to our patios, to arrange it in terms of what is best suited to accommodate for physical distancing. So it'd be impossible for me to answer that generally, but just to suggest that the common sense approach is to arrange your tables in order to maximize physical distancing for people to be able to move around where they're not coming within that space.
Thank you. We have time for just one more question here, and I've noticed in the feed that there have been multiples that revolve around questions pertaining to childcare and childcare settings. How do we help our children to socially distance? They are social creatures and animals by nature. Are there tips or advice or tricks, information you can share with us that help us to understand how best to manage our children in these childcare settings?
So thank you for that. I totally agree that children are just like the rest of us, social beings, but don't have the kind of the restraint that we would have as adults, and it's going to be inherently tough. They have requirements now that limit the size of groupings that can be together. And right off the bat, that helps a great deal because it reduces the probability in any smaller group that somebody's going to come in as a case. They're doing screening of children as they come in, and I expect the parents to be doing screening for any symptomatology. They have a protocol about immediate isolation and follow-up for a child who develops symptoms while they're present. There is a rigorous protocol about reducing surfaces that could become contaminated, and the frequency of disinfection. So all of that is essential for reducing the risk, noting that children are not going to do a very good job of physical distancing. I don't know, Dr. Rebellato, I don't know if further what you would add with regards to that.
Yeah, I think, the only thing I'll add, Dr. Gardner, and participants is that the importance, I think, of what Dr. Gardner referred to from a screening perspective, but also from a staffing perspective as well. There was a few questions about what the expectation is for different coverage of lunches and things like that. And really, it's ensuring that the facility is staffed enough in order to facilitate supervision, of course, of the children that are there in order to enforce that type of thing in terms of limiting that type of interaction, but also having enough staff in place to do all the necessary things that Dr. Gardner was referring to from a cleaning and sanitation perspective, coverage for lunch breaks and things like that, that allow that facility to operate in a really efficient manner, given all of the restrictions that they would be expected to operationalize as a part of that. So it really is a two-way street, not only with children, but also with staff as well, and ensuring that the operation is staffed sufficiently enough in order to operationalize all the activities that need to be done.
Dr. Stephen Rebellato, Dr. Charles Gardner, thank you again so much for your time this afternoon. We really do appreciate it. As a reminder to all participants, this has been recorded and will be made available to everybody that had registered. We'll also be stripping down the chat feature where there have been many more questions posted than we've been able to answer today, and we will certainly do our best to get all of that information to you. We care, we know you care, and together we will certainly make our best to get through this. A reminder to check the edo.simco.ca website for upcoming Ask the Expert series sessions. And a quick thank you as well to the team behind the scenes here, so Karen, to Johanna, and to Hannah. And lastly, another thank you to Jenny for sharing her insights as a business owner. We wish you all the best in this phase 2 reopening. Take care.
Goodbye, everybody.